Well, welcome to the 7 o'clock talk. And right now we're on the road. Jessica is searching for a new used vehicle or new to her vehicle. So, anyway,
Well, not willingly, but
but tonight we're going to talk about some of the stuff we've seen going on with insurance because honestly, it has just infuriated Jessica. So, actually, I'll turn the camera over to her here in a minute and she will talk about the things that she sees, the problems that we're having with insurance, that we see patients having with insurance. And then there's a thing for our older patients that are looking for Medicare because she's seen so many of our older patients get tricked into these advantage plans and stuff like that on insurance that really she has some advice for people. Now, once again, we are practitioners. We don't sell insurance. There's a lot of insurance that we and our colleagues have stopped actually taking. And she'll talk a little bit about that. As a matter of fact, I'll just turn it over to her. And she is right there. There you go. The floor is yours. You can rip on insurance. Yes.
well, one, I get totally tore up about insurance because one, everybody spends a lot of their money on it, and two, I feel like the majority, now not all insurance, not all companies take advantage or treat their employees bad with what I feel like is inadequate insurance, but we are finding that the majority of the patients that come to see us that have insurance have these crazy deductibles. And we used to see $500 deductible, $1,000 deductible, and now they are 6,000, 12,000, 22,000, which to me is basically you don't have insurance. And not only do you not have insurance, but you're paying for it. So they're taking your money out in your premiums, and then you're having to pay all your care at the provider's office. Now, your insurance does get you a discount sometimes, but that doesn't mean it always does. So that's the first thing. And then here in the last few months, they've went through and they're changing it up. So state insurance, well, what most people know as Medicaid. Um, that used to be basically free care across the board. And for instance, we used to have people that could come in for 50 visits, and then it was 50 codes, and now it's down to 6 visits or no visits at all. And now they're sending out things where those visits are now going to probably come with a $35 copay. So the state insurance is up in the air. And now they require prior authorizations. And a lot of them did anyway, but now basically no care is getting authorized. And the insurance, we call it the insurance game. Me and Tina, we spend hours and hours and hours trying to get things covered for our patients. And there's nothing more frustrating than jumping through all the hoops only to do the care and then have them take the money back or deny the payment. So,
Oh, hold on. Explain that to them. Explain the game because there's a huge insurance company whose CEO
well,
may or may not have.
you watch us, you know exactly who we're talking about. And we have been threatened. Our license have been threatened. And the only thing we actually do is try really hard to get our patients the care that they actually deserve. Not only they deserve it, but they pay for it. So now they get you. You have to have everything pre-authorized, and now they're going to this. You have to have even the first visit prior authorized. But in order to do that, you have to know one, what you're going to do, and two, you have to have diagnoses. Well, nobody's going to have diagnoses on anybody until you've actually seen them for the first time. And so to deny the first visit because you didn't get it prior authorized, but yet you don't know what their problems are is just absurd. And then,
Oh, they want us to just put diagnosis codes on there, and that is malpractice.
yeah, that's not
Good.
it's not right. And then we work really hard to get authorizations for therapy. A lot of times people need therapy. And so we get those things prior authorized, and then we do the care, and then they decide that they're going to take the money back. And that's not fair to us, and it's not fair to the patient. Of course, if it's state insurance, you can't recoup that money, so you're just out. And it's not just one patient. A lot of times it is 10 or 15 patients, which is a lot of our money. But yeah, one of the major it's the actual worst insurance. Not only do we not take it anymore, our local hospitals don't take it. They don't. They basically say that you agreed to receive $5 per day reimbursement on all of the care that you provide to all of their patients. So
break that down for me.
$5, meaning if there's 10 people that walk in our door and they had this particular insurance and their visit was $250 each, we're only going to get paid $5 maximum payment from this insurance company per day. So no provider in their right mind is going to do that. We can't even we can't pay our staff more than that. And so we have had to go through and get uncontracted with some of these people, and then they have this double layer. So when you have insurance and you and your provider bills your insurance company, and then you get this bill, it's not fair to you, and it's not fair to the providers. But so like each insurance company has a third party, I guess, like Optum. Optum oversees a umbrella of other health insurance, and so they layer these credentials, contracts, and you have no idea. You didn't even contract with them, and two, you have no idea what your reimbursement rate is, and they don't either, because we've spent the last 6+ months trying to find out. They'll say we're contracted. No, you're not contracted, unless it benefits them, and then they say we're contracted, but yet they can't produce a contract. And then the contract that they want to produce is greater than 20 years old. So I feel bad for our patients, and I am not a nice person. I will fight tooth and nail for people. I will be kind until it doesn't serve me anymore. And I don't understand why somebody that has zero medical credentials can make decisions about medical care for people. And so
probably need to tell them the story on that one.
So insurance companies are employing people to create authorizations of care that are not nurses, they're not doctors. They hold zero qualifications in the medical field, yet they are determining who gets care and who doesn't based on their diagnoses. So I don't understand that one. I will hold you absolutely accountable for your knowledge or your lack of knowledge, and you have to prove to me why you are creating a care plan for our patient, yet you haven't sat in a room, nor have you spoken to them.
So to your point there, even the ones that do have doctors and nurses, these doctors and nurses have never talked to the patient. Remember that one? We got that.
I can tell you the scenario on that one. We won't discuss names or anything, and we won't tell you who did it. But we have an older gentleman who really benefits from adjustments because it helps him with pain. And if something is helping somebody with their pain and their mobility, and it's not medications, then I feel everybody deserves that. So we seen this person for multiple visits. We wrote off 60 visits, which is a lot of money. But I called and we complained, and we went all the way up to the doctor who called us back. She did say she was still practicing, but I wanted her to explain to me, one, you've never sat in the room with our patient You've never discussed his care with him or anybody else. And how could you deny him care because you're saying that this care is inappropriate? Because they wanted to make sure he had been to a neurologist. But this person was overseen by a neurologist because he has had a history of
Seizures.
something neurological that
Yeah.
he's followed by. Anyway, they denied his care and said that he could not have adjustments, even though it did help with his pain. But anyway, we can rant on and on about insurance. You won't convince me that there is an insurance company that is a good one, especially if they are requiring authorizations and they can pull them at any time. I just don't think that it is good for the patient. It is good for the patient if they to help provide them care, but when you have an insurance company that is creating barriers to care, meaning you're taking, as a nurse, one whole paycheck that I made went towards insuring my family. One entire paycheck, which was 2 weeks worth of my time, I paid as a premium for healthcare. And so I don't know that that's much different for anybody else. But if you have to lose a paycheck just to pay for care, and then you take that card, which most people think is a benefit to them, and you go to the doctor, and then you're told that you have to pay for the first $6,000, $10,000, $12,000 worth of your care.
Plus a percentage.
That is a hardship. Yeah, because you have to pay that out of your pocket before there's any benefit. I just don't understand that in any way.
So one last thing is for our patients that are elderly that get scammed by these Advantage plans.
That's what I was getting ready to say when you said that. And now they went to these Advantage plans, but you cannot see another provider outside of your primary care physician without a referral, or they deny the care. And even when you have the referral in place, they deny the care. So be careful. And if you have a traditional Medicare as a nurse, and you can ask any nurse, most of the doctors that know anything about insurance will tell you the same thing. Do not get rid of your Part B Medicare. It is your best friend. The deductible is low. Now, and I hear everybody say, well, but I'm on a fixed income. Okay, so for instance, I think this year, Medicare, give or take, had a deductible of $256. Let's just say that. And then after you pay your $256, then it's an 80/20 plan. You don't have to get referrals. You don't have to get prior authorizations. It does have to be a covered benefit under the plan. But you can go anywhere you want to, and you don't have to ask permission. So if you get a Medicare Advantage plan, those are administered by Anthem. They are United Healthcare, UHC, UMR, all of those, Humana's.
Cigna.
They tell you that, you're going to get iron, you're going to get hearing aids, and we're going to give you money for food, and that is not true. And so not only is that not true, but if you are we'll just use chiropractic because that's our world, they have a $20 copay. So most of our Medicare patients like to come in at least once a week. So if you were coming in once a week to our clinic and you had a $20 copay, that's basically $100 habit a month. So $1,200 a year. So you have no savings, and that's just your chiropractic care. So do not get rid of your traditional Medicare plans. They are your best friends. The Medicare Advantage plans aren't a benefit to you. I promise.
And now we'll start my rant and I'll talk my talk. And as I say that, I actually haven't had health insurance. I had health insurance for a very small time when Jessica and I first got married, and I had it for like what, 6 months? Other than that, I don't have health insurance. Now, I do have the luxury of having access to labs and my training. So, am I telling you not to carry health insurance? No, I'm not. But I am saying, hey, if you have access to labs, or just think about this, most health insurance now seems to be just for catastrophic events, in my eyes, because I look at these people coming in with $7,000 for a deductible. Then they turn around and have copay, 80/20, whatever else, on top of what they pay in. So let's say they just pay $600 a month, which, if you're personally insured, $600 a month is low. So let's say you have $600 a month, you're looking at another $7,200. So you're now up to $14,000 out of your pocket for insurance that you can't use until you blow through that $14,000. And for me, I just looked at that and said, well, I can get my tests done. I can read my own tests. I can take care of myself and save my, and once again, if you follow us, you know that we talk about the 5 pillars of health, foundational health. And so having that foundational health, which is where I am at, then my chances of actually having an event, having a problem, are very low. I will knock wood on that. I'm not asking for something to happen. But I am saying that if you don't eat the standard American diet, and you take care of yourself, and you exercise, and you sleep, and you're not on any medications, and you're not supposed to be on medications, and your blood pressure's okay, and your lipid panel, not the old generic one, but your NMR, if all of that stuff actually looks good, you're taking very good care of yourself. Am I saying at that point in time you don't need insurance? Saying at that point in time, you're taking very good care of yourself, and you might only need catastrophic insurance. Because right now, if you're paying for one of these plans that's, look, I had a hernia repair and I didn't have health insurance. That hernia repair cost me, I think, all out the door was like, let's say it was high, go $5,000. That paid for everything for my hernia repair. And so at that point in time, I'm still ahead. I haven't had any other things happen to me that I've needed anything for. And we really, as a nation, got to start looking at the cost of insurance, because insurance actually drives up healthcare, the prices of healthcare, because the insurance company keeps cutting practitioners on one end of the spectrum, and they cut your benefits on the other end of the spectrum. And there's not a lot anybody can do about that. So they keep increasing their profits at our expense. And at some point in time, we all have to say, enough is enough, and we're going to take care of ourselves. How do we do it? And if you follow, not health influencers, I'm not a health influencer, I'm an educator. But if you follow health influencers and you're doing this fat diet, that fat diet, this funky exercise, you're looking for the next superfood, if that's your bag, yeah, you probably need insurance. But if you know how to eat, you know what to eat, you know how to take care of yourself, you know your basic metrics, you take care of the things that need to be taken care of, and you know how to get them taken care of. Whether you see a functional medicine doctor or someone else, I don't care. We can help you, but you got to make sure that things are on lockdown and you're in control before you do a move like I did. And time will tell if I've bit myself in the butt or not. So, I don't know the future. I'm not all knowing. So, but that's my rant. Really think about how much money you're spending and what is your return on investment. Because America is fabulous. If you're in a car wreck, if you get shot, blown up, something like that, you're golden. But when it comes to chronic diseases, lifestyle diseases, autoimmune diseases, basic health for people, we aren't good. We're not good at all. As a matter, ooh, that was a rough pothole. As a matter of fact, America is has some of the sickest people in the world, and you can prove it by statistics. You can look at what America's health expenditures are, where we rank in the world in terms of health. You can look at how we perform in pandemics and world crises, and we're not good. Not good at all. And so that's what you're paying all this money for. That's where your deductible is going. That's where your investment is going. And that's the return you're getting. And so if you're the CEO of your own health and you're getting those kinds of returns, you're probably going to look to do something different. That's my rant. That is Jessica's experience with our patients. And if you're just coming in, I recommend you go to YouTube, you subscribe so you get our updates. We don't normally do rants. Normally we're talking about health and health related things. This is health adjacent, but absolutely go listen to that. Go listen to what Jessica said, because it's very important to you. Anything else you want to add, hon? All right. With that, we'll sign off. Please, we're trying to get to 1,000 subscribers. Give us a subscribe and a like. Once we get to 1,000 subscribers, we will start actually giving away. We got lots of goodies. We have enzyme kits. We have supplements. We have gifts, swag, and all that kind of stuff. We can't wait to hand it out. So thank you, and we hope you have a wonderful evening, and we'll see you next time.